I'm here with Bonny Specker, epidemiologist from South Dakota State University, who is going to give us an update on everything that's been happening COVID across the state, in our area, in the country, and in the world. And also, she's going to give us a little bit of a lesson on epidemiology today. Bonny, what do you have to tell us about epidemiology?
Well, I know there were some questions about graphs and how do you choose the different graphs that are made, and I thought I'd just give a really simple little description of what we try to do with the graphs. You can have two kinds of graphs. I mean, there's all kinds of graphs, but two of them are shown here. And on both of them, we have day along the bottom, and we have the number, in this case, number of cases, you could think. And here we're treating day as a continuous variable, and that would mean that you would then connect these different points. And here we treat day as a categorical variable, and each of these little bars is what it is on that particular day. So day 4, it's 4 cases. Same thing over here, it's just here they're connected. I mean, day is a continuous variable, but when you think of it, we're only getting case numbers in a set day, not throughout the day. Like if it was by time, you could even make it more fine than just day. It could be like 1 p.m., 4 p.m., and make it more continuous that way. And there's also different shapes of curves. This is just a linear relationship, what we call linear, where the increase or decrease, if it was a decrease, the line would be going in this direction, is the same each day. So this particular graph shows an increase of 1 for each day, nice and straight. And then you have what's called an exponential relationship. And this is where the increases or decreases, if it was going the other way, it are different each day by a set amounts, a set function, or what we call a function. So here, if you look at between day 6 and 7, I just put this red line to show what the slope of that line is. So this is telling you what the increase is between day 6 and 7. And you can see that out here, the slope is much greater. There's a much greater increase between 9 and 10 in the number of cases than there was between 6 and 7. So I'm going to show some examples of the actual graphs and how you can kind of look at them thinking about the different types of relationships. So under the cumulative graphs, and we have this for cases, hospitalizations, deaths, on the daily data report that the city posts. But this is the one with cumulative number of hospitalizations in South Dakota. And you can see here early on, back in March and early April, it was really flat. And then it started increasing. And this is pretty much a linear increase right through here. And then it looks like it slowed down a little bit. It's not going up as fast as it did back right through here. And then this, since probably early back in here, it started increasing more rapidly. And you can see the slope of this line is now going up quite a bit faster. And if you look at the actual percent increase, you can see that here in the month of July, we had an increase, a 23% increase in the number of cases between here and here. Whereas over here in the month of October, between here and here, it increased 72%. So this is how I show cumulative cases. Someone else could have done it, treating age as a categorical variable or a category. And it's showing that this rate of increase in the number of cases is varying over time, is what that is good at showing. Now, another way of looking at hospitalization data, which is also in the daily update, is looking at the number of new hospitalizations by day. And here, each of these vertical lines are the number of cases that were observed or reported on the Department of Health dashboard on that particular day. And you can see the line's a little bit different because we're not adding, this is each individual day, what are the number of cases. We could have easily have just plotted this with day as a continuous variable, but I chose to plot it this way because I wanted to add what we call the 7-day running average. And the reason we do that is because you see there's these little variations in the blue lines. And that's because of reporting on weekends is usually decreased. So these numbers will be low around the weekends. And then there's a lot of sort of day-to-day variability. And this 7-day running average smooths that out. And it lets us look at trends over time. And as you can see, for the past couple weeks, we've had an increase in the number of hospitalizations that are occurring each day. And we can actually look at this where this yellow line is, and it's around 60 hospitalizations a day. So 60 people a day are being hospitalized. And so here are those same two graphs just on top of each other. And one thing could be, well, why do you use these different graphs? Well, this cumulative number is going to show information on the total number of people ever hospitalized. We couldn't really do that down here. We'd have to go through and add up each one of these little vertical bars to come up with these totals. So this is giving us information on the total people hospitalized since March 1st. Whereas this graph is showing more information on the total number of people hospitalized each day and what has been happening in terms of the trend for that data. And here, just to show you, I drew this by hand, so I apologize for looking a little odd, but I just wanted to show you what's going to happen when the cases start declining or the number of hospitalizations. So here, this 7-day running average will start to fall, okay, and then it eventually will go down to 0 when this is all over. And what will happen up here is this, because it's the cumulative or the total to date, is never going to drop down. But you can see that when this gets down to 0, this is going to be completely flat because there's no additional cases each day. So that slope's going to slow down here, and then it's going to keep getting slower and slower, or less and less of a slope, until down here where it's 0, this will be flat. So that's how those two graphs would look. Now, there are other types of graphs, and I just picked 2 of these that I really like that are off of SD Jim's Twitter account. He's a physician out in Rapid City, a retired physician. And this one on the left, I particularly like. This is day across the axis here, and this is percent. And what he is showing is the differences in the age of cases over time. So the green colors are younger individuals, and the lighter green it gets, the younger it gets. And the red are the older individuals, the 60 plus are the orange and red. And then the middle age are the blue. And you can see that early on in South Dakota, a lot of the cases were young. They were in this green section. They're taking up a big chunk. But then over time, this red area has become larger. And this is why we're probably seeing the increase in hospitalizations, because that's where you get increased, hospitalizations with older ages. On this graph on the right-hand side, this is an interesting graph. I do not track this data, but he has plotted it really nice. These are the number of deaths among South Dakota residents. This dark line, again, this bottom is date here along here, and this is the cumulative number of deaths. And you can see that over time, this darker area is increasing. It's a cumulative graph. But the thing that's interesting is where the deaths are occurring. And the dark bar is the deaths that occur within a hospital, whereas the light gray bar are deaths that occur outside of the hospital from COVID. These are probably nursing home deaths or elderly people who tend to not go into the hospital when they have really severe disease. But I thought this was interesting, and it's holding around 60% of the deaths from COVID are actually in a hospital, and 40% are outside of the hospital. So graphs are essentially used to visualize data, and there are many types of graphs that can be used to convey different aspects of the data or even the same aspects. You can use different types. I think the important thing is to pay attention to the graph title, like what is the graph actually of, and then look at the axes, the x-axis and the y-axis, and make sure you understand what it is that is being graphed. And I think that it's probably the best lesson on interpreting graphs.
Thank you so much for that lesson on epidemiology and graphs. What do you have for us today about COVID-19?
Well, in Brookings County, we've had kind of a rough week towards the end. Last week, all the graphs I showed on the side were the new cases. This week, I decided to throw in a different graph. Again, all of these graphs are in that daily data report. There have been a total of 1,784 cases in Brookings. This past week, there were 239 cases compared to 165 last week. 453 active cases on November 8th. This is up from 338 the Sunday before. There have been 58 people ever hospitalized. There were 11 new admissions this week compared to 7 the prior week. There have been a total of 9 deaths. 3 of these have been just this past week. We are still in substantial community spread. When we get below 33 new cases per week, we'll be down to moderate spread. So we have a little bit of a ways to go on that. Test positivity among people tested is 41%. And among tests that have been done, it's 19%. Both of these are high according to the World Health Organization, who recommends that this percent be below 5. In South Dakota, we've had 55,000 cases, 8,080 this week, compared to 8,121 in the previous week. So that has tapered off just a little bit. It'll be interesting to see what happens this week. You know, keep our fingers crossed that the new cases are leveling out. The reason I'm not real optimistic about that is because the test positivity is so high, and I'll get to that in a second. But we had 15,750 active cases yesterday, and that's up from 13,138 the previous Sunday. There were 3,184 people who have ever been hospitalized. 463 of those admissions have been this week versus 285 admissions in the prior week. And there were, as of yesterday, 546 individuals hospitalized in South Dakota with COVID, and that's up from 421 the previous Sunday. There have been 536 total deaths as of yesterday. 99 of those deaths occurred this past week compared to 62 deaths occurring in the previous week. And that's what this graph is showing. This is per day, so each of these blue lines are the number of deaths in that particular day. But you can see this average is going up. We're at about 13 deaths per day on average. The test positivity that I was mentioning, that I wish it was a little better, it would give me more confidence in the cases plateauing out, is 54% if you look among people tested. So not very much testing is going on. 24% test positivity among tests. Again, you want that below 5. I added all the numbers for each of these dots, and it's gotten a little busy, but I think people might want to know what the actual numbers are because it gets hard to read when it's so far from that axis. But this is the K-12 and higher education numbers. This line, the yellow line with the pink dots, are the K-12 students. The yellow line with the red dots are the staff at K-12 institutions. This blue line with the pink dots are students in higher ed. And down here, the blue line with the red dots are the staff in institutions of higher education. So the K-12 students are still going up. And the teachers are behind them. Same with the colleges. If you look at the US, there are now over 10 million cases. So that happened this week, hitting that point. This past week, there were 780,000 new cases compared to 574,000 the previous week. 243,257 total deaths. There were 7,100 deaths this past week, about 1,000 deaths a day, compared to 6,000 deaths in the previous week. Worldwide, there's over 50 million cases now, 3.88 million cases this week, compared to 3.45 million in the previous week. Over about 1.25 million deaths, 55,000 deaths this week, compared to 45,000 in the previous week. So you can see the deaths worldwide are starting to increase. And this is expected, and it's expected to get worse because of the flu situation. Travel is the same as last week. I checked it. This is updated on November 5th. It's all the same except this Florida and Idaho. You have to check on those individually because certain county or cities might have restrictions. And this website is open even if you're not a subscriber to the New York Times. They allow access to everyone. Protect others as always. Wear a mask, socially distance, and get tested if you have symptoms or are a contact. And then we can get that test positivity down and get this under control. So.
Thank you so much for the update, Bonnie. Just a reminder for those of you who watch this weekly, if you have a question for Bonnie, there is a contact email address in the description of this video, and you can definitely email us. And if you have any questions for Bonnie, we'll get those answered. So thank you guys for watching.
Thank you. Bye.